I grew up in Southern California. I grew up on the beach in Southern California, 2 blocks from the ocean, Manhattan Beach, California. I went to medical school at the University of Southern California, and the urology department there is world famous. There was a guy named Dr. Donald Skinner, who was he's an iconic urologist, and he's the one that talked me into going into urology. So after medical school, I went to Indiana University and did my residency there. And that's a 6-year difficult residency, but a fantastic residency. After that, I ended up in Michigan, in southwestern Michigan, in Grand Rapids, and ultimately joined a practice in Holland, Michigan. And practiced there for a long time. Kids, wife, etc. Sort of slowed down my practice and talked to Dr. Bates, and he said, hey, come out to Watford City, North Dakota. And I said, where? Watford City, North Dakota. So I came here last summer and just visited, and it was a good thing. This is a really functional healthcare system. It's amazing the scope of patients they get from the distances. A lot of people come here because of the quality of the care here. And to have this in this community is incredibly important, both from the standpoint of acute specialized care for something like kidney stones and inability to urinate and urinary infections, to more chronic long-term care like prostate cancer and kidney cancer and bladder cancer. There's such a huge demand, and the nice thing about this place is that the hospital has recognized that, and they've provided us with tools that I don't have in Michigan in my last practice. Having appropriate and effective and comprehensive health care improves the quality of life for any community. We know that. And the nice thing about this place is it's sort of still small enough to be really personable, but they've made investments in the infrastructure here to effectively treat people here and to keep people here. There's very few patients that we're going to see where we need to send them to Bismarck or Minneapolis or the Mayo Clinic. Really 90% of what we do can be assessed and treated here.